Thank you, Madam Presiding Officer. Good afternoon to this august House. Good afternoon to those who are listening, who are viewing on the various media platforms. Good afternoon to my colleagues. I would like to start my presentation this afternoon, given that this is the first time I've risen to my feet to speak, to present in this term. I'd like to start by congratulating you, Madam Presiding Officer, for elevating to such an auspicious level. I would also like to say a special thank you to the electoral district of Belgarden Glamorgan that has gotten me to this point. I want to also thank the Chief Secretary of the Tobago House of Assembly for his astute leadership, which has allowed us again to get to this point. And finally, I would like to thank my division, the Division of Health, Wellness, and Social Protection. This is a division that has been tasked with possibly the most difficult responsibilities over the last couple years. And I would like to thank each and every one of those who have worked over the last 2 years, those who've worked with me thus far, the 3 administrators that we've had since December, my Assistant Secretary, Mr. Sonny Craig, all of the heads of departments within that division, including those in the Tobago Regional Health Authority. Because one thing that we've learned over the last 2 years is that COVID-19 has identified for all of us every single crack that has been in our system. It identified the fact that many of us did not have medical security. It identified the fact that many of us did not have economic security. It identified the fact that many of us did not have the kind of social support that we thought we had. And in many instances, it caused many of our individuals, many of our families, many of our communities to almost break. It's been a difficult 2 years. It's been a difficult 2 years, and one that has identified many of the deficiencies within our social protection system. So I would like to start by describing or explaining the reason we decided to change the name of the division that I now lead to Health, Wellness, and Social Protection. I think the health and wellness parts we are used to. We understand what those means. But I think we need to spend a little bit of time thinking about what the concept of social protection is, because that is the foundation of the motion that I raise today, Madam Presiding Officer. Social protection really is a process or a series of components within a system that allows individuals, allows families, allows communities to withstand what are known as shocks. Usually when we think about shocks, we think about the negative things. COVID-19, the shocks, illness, the shocks, loss of employment, the shocks, death, the shocks, being forced to be confined in a home with individuals who may be your worst enemies, being forced to be in a space where you are afraid of your family members, the shocks, having our young people, our children in school, out of school for that period, School, for many of them, was a place of safety. School, for many of them, was their safe haven. And for 2 years, we allowed them to be in a space where they may not have been safe.
Okay.
But shocks could also be positive things. Shocks is really any change in life. And I always give the example of a positive shock. You know, a young woman who just got married, a young woman who may have been raised in a Christian home, so, did not defile, quote unquote, herself. A young woman who may not have ever slept in the same bed with the man that she is now married to, only to realize on the night of her wedding that he snores. And she now realizes that she may never get another good night's rest because this man who she absolutely loves snores. Social protection is giving us all the technical capacity, giving us all the skills, giving us all the resources to ensure that we can withstand those shocks. The shocks that may be negative and the shocks that may be positive. Allowing us to say, hey, this is what happened. The breadwinner is no longer the breadwinner, but we could figure out what we need to do as a family because we were prepared. We now know that we have to go and learn a skill and start a new business. We are now prepared. That is what social protection is. And coming into this, understanding what social protection is, we at the division decided that we needed to do everything that we could do to make that happen. Now, if you look back at the campaign included the Chief Secretary at the end of practically every statement or every speech that he gave, spoke about Tobago being the greatest little island on this planet. And because we have to make Tobago the greatest little island on this planet, we have been doing a critical assessment of what it really takes to ensure that we do the kind of social protection that is necessary for our Tobago people. That assessment included listening to different groups of people. They come to me all the time. The workers within the division, the individuals who are clients within the division, individuals who are clients in other divisions, my colleagues, secretaries and assistant secretaries. Almost every day, one of them messages me and says, this individual who is my constituent needs help. So we've been listening to the frustrations of those who provide the service on one end, and listening to the frustrations of those who receive the service. Can I just say that one of the things that my Chief Secretary said to us the other day, and well, we just tell each other secrets. He said, you see that form all let us use? That form too difficult. That form, all you have to change that form because that form is causing people to be frustrated. And it is little things like this that we have to sit down and critically look at to determine what is best for how we provide services. The social workers, they've been saying to me, Faith, we're tired. And we're tired. We're tired, try to do the work, and then it doesn't work. We are tired of trying to do the best that we can for our clients, but because we do not have a process, an official process that allows us to get together and allows us to speak to each other and allows us to really interact in a way that is meaningful for our clients, we feel that we are not providing the best service. We've been listening. The clients say to us, Dr. Faith, I come to social services, I fill out the form there, and then because we've recognized that we need help with housing, they send me down to Crown Point. I came to town with the last $10 that I had, and now they're sending me down to Crown Point. Or they are telling me that we do not have food cards at social services, social protection, so they're sending me back in town to finance, because that is where the short-term social service cards are housed. Dr. Faith, we came to that office because we needed help. And it feels like we have to beg for the help. It feels like we have to keep telling our sad story. It feels like we have to keep talking and we have to keep going and sitting down whole day because, well, thank God the dress code rules are now out the door. But we do not feel like we are getting the kind of help that we need.
Member, I don't know if it slipped me, but did you read the motion?
I did not.
Can you please do so?
Sure. The motion reads, whereas COVID-19 has caused significant socio-economic challenges for individuals, families, and communities in Tobago due to its designation as a pandemic and the public health regulations put in place to safeguard citizens, and whereas the Tobago House of Assembly, via the 5th schedule of the THA Act, is responsible for social welfare, and whereas the mandate of this new THA executive is to make Tobago the greatest little island on the planet via sound policies and the execution of people-centered programs, be it resolved that the THA utilizes a whole-of-government approach to its distribution of social support to those in need in Tobago, using a case conferencing model to treat with all clients requesting psychosocial support at the various divisions, and be it further resolved that a committee of social support staff from each division be convened to create the policy that guides how this process is implemented by June 30th, 2022.
Thank you. You may proceed.
Thank you, Madam Presiding Officer. So I've laid out the many concerns. I've laid the many questions. I've laid out the frustrations that many of our clients and our service providers have outlined to us. We are now in a position as the Executive Council of the Tobago House of Assembly to do something about it. We are now in a position to make a policy decision, which is why we come to this House at least once a month to debate the policies that are important to the people of Tobago. We are now in a position to do something about it. While having conversations, Madam Presiding Officer, with some of the individuals who provide social support within the divisions, one of the things they suggested, and is the crux, as they say, of this motion, is the idea of having all social support staff within the Tobago House of Assembly work as if the Tobago House of Assembly is a single entity and not silos doing their own thing. We have individuals within each of the divisions who provide some level of social support. It's obvious at the Division of Health, Wellness, and Social Protection. We provide the rental assistance. We provide food vouchers if those are available. We provide counseling. We provide housing if that is necessary. We provide those kinds of support. But if you are someone who needs help with building your house or constructing your house, you would then have to go to the division with responsibility for settlements. If you have a student who needs help getting uniform or books, you then have to go to the Division of Education. If you are entering the Tobago Regional Health Authority and for some reason you need a service that we cannot provide at the Tobago Regional Health Authority, you then need to be rerouted back to the Division of Health, Wellness, and Social Protection to get that medical treatment, that medical support, or the financial support to allow you to get that medical treatment. We are now at the point where we've all recognized that it is critical for us to treat the Tobago House of Assembly as a single entity known as the Tobago House of Assembly, and therefore provide an opportunity for those who do the social support to come together and work together for the client. And we have to remember that that is why we're doing this, for the client, for the client. One of the things I think that we've been doing before is what is known as case coordination. And I think that is because the social support staff, the social workers and social work assistants and the various entities understand that it is important to communicate with each other, that it's important to share information with each other, to do some collaboration and to do that kind of thing, but that is not quite what we're talking about. We need to go a little further than just case coordination. And that is why this motion specifically asked us to use a case conferencing model to work together. And let me define what case conferencing is. It is a more formal, planned, and structured event which is separate from regular contact with the clients. Let me repeat that. It is a more formal, planned, and structured event that is separate from the regular contact we have with the clients. The goal of case conferencing is to provide holistic, coordinated, and integrated services across providers and to reduce duplication. Now, that is another thing that has come up quite a bit. We have clients, because they are trying their best to get as many services as they can, because they need it. They go social support shopping, for want of a better term. And they go to one division and then go to another division and they go to another division and they go to another division because they're really trying to get as much as they can out of the system. Now, what the case conferencing would allow us to do is for all of the entities within all of these divisions who are providing their various kinds of support to sit in a single room. Now, COVID has taught us that that room can be a virtual room, and to actually have careful consideration for the needs of the client. So what would that do? Someone walks into the Division of Health, Wellness, and Social Protection. Their information is collected at the Division of Health, Wellness, and Social Protection. An initial assessment is done at the Division of Health, Wellness, and Social Protection. And because I have confidence in the social workers and my social work assistants there, I know that when they do an assessment, it is a real thorough assessment. Now that they've done that assessment, they realize that even though the person who walked in came in saying they want food, because they've done a real assessment, they've recognized that, yes, They do need food. But just handing them a food card or just handing them a food voucher is not going to solve their problems. What we need to do is to look at the entire individual and figure out what is best for them. What is best for them may actually be working with settlements, because the only reason they are in need of food is because the house that they used to live in is in disrepair, so they are now forced to rent. And the rental amount is out of their reach. They may then realize that this person actually has a skill, a real skill that is marketable, a real skill that they can use to make money with. So they can direct them within the division to the REACH program, where we give small grants for individuals who want to start up businesses. But if they have a bigger business idea, we can then direct them to BDU, where they can get a larger grant to continue doing their business. They may realize that even though they came in and spoke about food, that they actually have children who are home who have not gone to school yet because they do not have the uniform, they do not have the school books, they do not have the school shoe, and instead of just sending them over to education, the case conferencing would allow them to speak to the various social workers, social support staff, to get what is needed for this particular client. Now, what that does is ensure that when we are done with the client has gained the capacity to no longer be a client. And I want you all to think about that a little bit. The aim of social support, the aim of social protection is to ensure that we get the client to a point where they no longer need to be clients. And if what we are doing does not get them to the point where they no longer need to be clients, what we are doing is to just tag them along, not building their capacity, not giving them the tools to give them the technical competence to no longer need our service. And that is why it is so important for us to use that case conferencing mechanism to ensure that when that client walks into any door, and that is critical, when that client walks into any door in any division, the assessment that they would get at that division would allow them to access the kind of services that would get them to the point of no longer needing social support, maybe a couple months later, a year later, would get them to that point because they've walked in one door. And the health professionals, the social support professionals are the ones who are sitting around the table saying, you know what? Miss so-and-so, this is her situation. I think she needs this, that, and the other. What do you think? Can we get her this, that, and the other? Can we get him this, that, and the other? To ensure that when that client is served, they are served to the best of our ability. The second whereas of the second resolution of the motion is one that allows, I think, the professionals to be the drivers of this process. They are the ones who've been on the ground doing it. They are the ones who understand what needs to be done. They are the ones who've gone to school and have the experience to do it. So what we're doing is asking them to sit together to work through the actual process, to work through the policy that they will then use to implement this case conferencing model in the future. And yes, because I'm the kind of person, and because we know that we need deadlines, and because we know that the social workers are competent, they can provide that policy by June 30th, because they already have it, I'm sure, right? Yes, already have it worked out. So, Madam Presiding Officer, the aim of this is simple in my mind. We have to figure out how to do what is best for our clients. The Tobago House of Assembly has the policy of this executive of the Tobago House of Assembly is one where we have spoken quite a bit about digitization. And we do know from chatting with those who provide the support that that is a critical part to being able to do this. Because one of the things we hear it very frequently is that if the client comes in and the client puts in their name, address, date of birth, the number of children, they have the name of the children and so forth, those things don't change when they move from one division to the next. So if we have a central system where that kind of information could be put in so that when they are seeking support from the other divisions, the social support staff already have all of the background, they already have the basic information, that would help the process so much faster. So, Madam Presiding Officer, in my mind and in the mind of the Executive Council, the motion today is a simple one. It is one that puts the clients, it is one that puts the people of Tobago at the center of service provision. It is one that allows individuals to not have to go, as we say, begging cap in hand. It is one that would allow us to provide the kind of social support that we so critically need in a way that allows the client their dignity, in a way that allows the client to feel like we actually do love and care for them, and in a way that allows them to get the best support that they can get using our resources in the most effective and most efficient manner. And it is because of that, Madam Presiding Officer, that I am asking all of my colleagues, all of the members of this House, to support this very simple motion. I round up by reading the motion again. It says, whereas COVID-19 has caused significant socio-economic challenges for individuals, families, and communities in Tobago, due to its designation as a pandemic and the public health regulations put in place to safeguard citizens. And whereas the Tobago House of Assembly, via the 5th schedule of the Tobago House of Assembly Act, is responsible for social welfare. And whereas the mandate of this new THA executive is to make Tobago the greatest little island on the planet, via sound policies and the execution of people-centered programs, be it resolved that the THA utilize a whole-of-government approach to its distribution of social support to those in need in Tobago, using a case conferencing model to treat with all clients requesting psychosocial support at the various divisions. And be it further resolved that a committee of social support staff from each division be convened to create a policy that guides how this process is implemented by June 30th, 2020. Madam Presiding Officer, I so move.